Okay, we will go ahead at this point and now review the children's, oh, sorry, I said he was right. Okay, at this point in time, we will go ahead and review the Children's Justice Center budgetary requests. We excuse their director, who unfortunately has had a personal family matter that's kept her from us today. On their additional asks, they have 5 additional asks: IT increase, the janitorial contract increase, the adjustment because of the market study, and the market study benefits.
What I don't see in here is, oh, total fund. The only question I had, Deneen, was the 149 including those additional asks, or is it 149 plus this $20,000?
The 149 includes those additional
Okay.
asks, and that 149 is lower than.
I was gonna say that
Yeah,
she does a great job.
right.
Normally lines 4 and 5, we don't hold anybody accountable for those because those are commission approved positions. $120 for janitorial's nothing. And IT, it is what it is, right? So, yep. Wish her well. She does a great job for us.
Pretty simple and straightforward.
Yeah, I did send her an email just to confirm that that was the right amount, that I was understanding the budget correctly. So if I have any information to the contrary, I'll be sure and pass that on.
Okay.
Perfect. Thank you. Thanks for coming early, gentlemen.
Right on cue. Are we up?
You're up.
All right.
Are we still recording? Okay.
Okay. Well, thank you. Appreciate the opportunity to present our budget for you for 2019. I see we have a large audience to listen as well, or here as well, and I hope Lisa can take it. Okay. You know, it's always been a challenge to face a new budget year, you know, with the realities of limited resources. And it's been said that the happiest people don't necessarily have the best of everything. They just make the best of everything. So now you know why public health workers are so happy. Budget preparation is challenging enough.
What I heard you say was we don't need to go over additional requests because you'll make it happy no matter what.
Well, we've learned to live with what we get, you know. Understanding the many competing interests. Budget preparation is challenging enough as it is, but changing budgetary practices and getting needed budget information late adds additional challenges. We so appreciate Deneen Jackson as she's worked through questions and processes with us using the new budget sheets. And using the new spreadsheets is more challenging to do some test totals to make sure nothing is forgotten in the process. So it may be wise to have a healthy contingency or restricted funds to help in case requests have been missed due to the new process. We ask our staff to budget their anticipated needs, and we review those needs with them and reduce or eliminate requests that seem out of line with our many grants or community needs. For this reason, actuals from a previous year are not always an accurate place to start, including the fact that we generally deal with at least 5 fiscal years and need some flexibility to make sure that we can bill out contracts. And so how we bill those out may not always reflect in the actuals that we spend in a county fiscal year. You know, we ask our staff to avoid the temptation to spend money just because they have the budget, but rather because they have a need. Yeah, I've been here for a long time, as you probably are aware. And when I was a newbie starting with the county, I had the opportunity to be down and talking to another department. And this remains with me for over 30 years, and so you know, it probably made an impact. But they were talking about going to a conference up in Canada. And I thought, well, I wonder why they're going to Canada. So I asked, and being a little naive, I thought I'd get something like, well, we're going because we need this training or this and that. But I was told we're going because if we don't, we lose the money. And I guess I was offended enough by that as I began working in administration in the health department, I tried to make sure that that was never the reason we spent money in our budget. And I think if you look at us over the years, we've been very successful in the process. Maybe the auditor's office can give a rebuttal or agree. So, but here are some important considerations I'd like to share as we approach the 2019 budget. It's always essential to take care of our employees. I appreciate the Commission implementing the COLA and market study last year. The vast majority of our employees who've spoken to me about this are also very appreciative of these efforts. I'd encourage the Commission to continue a yearly COLA increase so that come salary survey time, most positions will not be significantly out of whack with the marketplace. As our most important resources, our employees deserve to continue to be treated as you've done this past year. We continue to struggle to find qualified employees in some areas of the department, particularly in nursing. The more competitive we can keep our wages, the better served our residents will be. As the county grows, it's important to take the services to the people. Driving to Provo from many areas of the county is no longer a best practice for walk-in services. It is true that the work has changed as electronic and online systems have advanced. However, we still must rely on face-to-face services for things like immunization and those desiring immediate access to their vital records. We would love to be able to immunize over the phone or internet as a convenience to our customers and to give government conspiracists something to blog and tweet about. I'm glad you caught that. So. A better presence for these types of walk-in services is needed in the north end of the county where so much growth is taking place. The use of our leased facilities there has been a tremendous success. However, the facility we have there was not originally designed for the services we provide, creating some awkwardness in service delivery. With the county now owning property even closer to the high growth areas, we'd hope the county facility can be constructed on that property to serve our citizens even better in the near future. We hope our experience with our upcoming joint services in Payson with substance abuse and Washington's mental health will be equally successful as American Fork has been. In our 2019 budget, you'll notice some more resources be requested for social media promotions, chiefly Facebook. As our county demographics continue to change, continuing to be a very young county, our outreach efforts also need to be adjusted. Serious frustration for us the past couple of years has been our inability to get some contracted help to redo and update our website. We've put monies in again, hoping to get this going in 2019.
Because you keep trying to use a state vendor.
Yes, try to use a state vendor. We're almost to the point of giving up on that. But
I said that 2 years ago. Do you want me to replay you the minutes?
No, I don't. But the state vendor is 10 to 20 times cheaper than anybody else we've been able to find.
And you get what you pay for.
What you pay for. I don't know if Public Works is presented yet, but if they're hoping to upgrade the telephone system, we'd certainly like to support that. The current system kind of breaks at times and gets people frustrated.
If you remember, they didn't
places.
actually talk about that in their budget meeting, but they were just for people watching. They had plenty of reserves in their phone budget that the commission said go ahead and do it because that's what that money's there for already. So they could have already done that.
Hopefully that's on this.
They have been busy with the fire, but
yeah, that's true. Well, we'll take a minute here and review our new budget requests so that we can answer any of your questions regarding those staffing plans. I don't know exactly what order these may have
so our
come
first
to
one
you.
is mosquito abatement.
Mosquito abatement.
Yeah. So I have a couple questions before. So the way you combined them, line one's fine, but I'd like to come back to that real quick.
Okay.
Because there's a bunch of requests in that 112,000. My question is very simple, and it may be even just for Deneen. Utility heater for the chemical shed. The shed, Public Works controls and takes care of the space or charges for the rental for the auditor, election stuff. Do they not do the same for the chemical? Is that?
Well, there is a building charge. I mean, one way or another, they'd still be paying for it either through their building rental rate or purchasing it
That,
directly.
and see, and that's my question. If it's on that building rental, why didn't it come through already on their requests so that it was already adjusted into the new rate he was giving? This is the part that bothers me. I've always contested that Public Works at times comes to you guys and tells you request, even though they've already done the request, and I think we're double funding, and I think, this is my own thought. I think if we approve it for you, they pull it out of their budget and then pull it from you and ask for a transfer.
I think in this case, the chemical shed area is not heated. There's no.
No, I
heat, so-
understand, but
Okay.
the shed is not your responsibility. The chemicals and mosquitoes are your responsibility.
Yeah.
Public Works charges you a rental fee for that. To upgrade to a heater would just increase the cost per foot that they charge you already on your rate.
Well, that would work.
That, I believe, is the process we've set up, and that's how it should be done. So,
It just, when they're out there working in the winter, it just gets too cold for them to work.
again,
you know.
I'm supportive of that. I just don't think that's your request to have to make to the commission. I think that's what you talk to with Public Works.
Public Works.
And then they come and talk about
My
it.
question goes along with that. It's probably the same thing, but worded maybe a little bit differently, and that is that when we look at, a heating system is looked, I look at a heating system as a permanent fixture in a enclosed area. And so when we talk about capital expense projects, it should be a part of, in my opinion, again, it's something that stays with the building. It's not an add-on, it's not something different. Now, we're using it different now because we don't have anything in there.
Yeah.
And maybe that's the confusion with it, but if it's gonna be used in an appropriate way, it's like walls, ceilings, roofs.
Right, but the maintenance would be coming out of the rental rate. The
Yeah,
cost.
I'm
Yes.
talking about
Yeah,
this,
yeah.
this is a cost number right here.
Right.
Yeah.
Yeah.
I don't think there'd be any problems, just as long as we can get some heat in there to work in the winter. Yeah.
Well, so
If that's
keep in
part
mind,
of the
here's the
rent,
other
fine.
problem. Let's say we approve this. When does this go into effect?
Well, yeah, right in the dead of winter.
So going back to Commissioner Lee's point, the capital expense, I don't think any of us don't realize the importance of that. But I think that's a conversation we need to have now with Public Works as a capital expense. Adjust your rate going forward on the maintenance of that.
Yeah, I agree. I think it would have, like, when they sent out the building maintenance sheets,
Yeah.
that's
Yes.
where this should have gone
That's where
on
this
to
is,
go
yeah.
back to Public Works
So-
and have, right.
If you'll make that change, I don't think that's for
Okay,
us.
that's fair for us to talk to Public Works about it,
But again,
try to get it in there.
it's October.
Yeah,
We got beautiful weather this week.
that's very true.
So I got one just so I get on the right page. If I turn over, it says the requested changes is 112,715. But when I look down through this, and it's, on the front page, it says 119,285. So are you just
That's
you're
all
just
of
showing
those.
all the ones for 112? Is that all you're doing with that?
no,
No, no,
no,
no,
no.
go to the next page. So you go to that horizontal page. Do you not have that?
I've got
On
it.
the back of that where you're holding it. On the back of the one you're holding in your right hand.
Oh, yeah.
So if you go
this
down
is
the
the
middle
one.
column right there, that totals 112,715.
Right. Well, what I'm saying is the numbers, you have 119 and 112.
Well, the 119 includes
Is all of those
the
plus
new
that.
things.
So you're
There's
just,
also
so
some-
the 112 this is just showing everything inside here, and then the additional is what you have. here.
Right, those
Okay.
are new things
Okay, I
like we've
got it.
never had
Well,
before.
but the 112 is additional too.
Oh, it is additional.
Oh, yeah, well,
Okay.
it's additional beyond a previous year's
R-
actuals.
understood.
Right,
So,
yeah.
But I also appreciate the fact that when I'm looking down through there, it shows real numbers and real look at.
And why?
When I see others going down, which is,
right. So
Yeah.
like when you see insecticides and it says 73,000, here's the actual cost for ULV, air, larval.
Yeah, and in the past, the commission's restricted some of that until we needed it, and if you decide to do that again, I don't think we have any problem with that.
I do like the additional 500 for the line item annual conference in Kansas City, Missouri, or Kansas City, Missouri, but this conference is held in Florida, by the way, even though that's the line item that you guys added the appropriate.
Oh, okay.
So
All right,
So why restricted, for example, insecticides and chemicals? I mean, I know that's,
so you've just done that in the past, and, as long as we
yeah,
can
but
get it if we
when
need
you
it.
go
Invoices
through it
and
like that,
quotes.
it seems like that's kind of where that you guys feel it's coming in at is 273.
Oh, yeah, in most years. I mean, if we have a real dry year, we may use less. we have a real wet year, we may need more, so
You're gonna need more than this year, we hope.
we hope, yeah.
More in the
Unless,
right places.
Unless it all
Yeah.
goes in the wrong places and all we have is
Mud.
floods that.
Yeah, that's why I say, more in the right places.
Believe me, we're worried about flooding that may wipe out drinking water systems and septic systems and even take out sewer lines, you know. It can create a lot of havoc.
But the only thing I want our water to do is take out our algae bloom.
I don't think it's gonna do that, so.
Okay, so the 15,000 air spraying. The time limited employee wages, increase of numbers of staff hours, there's no people at it, it looks like that's just what you're projecting with spraying and all those things they do with the current staff
Well,
levels.
And, you know, some minor raises and things. I think, let's see, what was the time limit? I think we, without looking, I'd have to look, but I think we're already over the 118,000 figure for this year, so.
It's pretty straightforward.
You know, and again, even with time-limited employees, you end up budgeting for a certain amount, and then there's attrition. Or you can't fill positions, and you end up with some surplus there.
Sure.
Which isn't necessarily a bad thing. So. Again, we don't stress to employees they have to spend every cent of what's budgeted, but encourage them to spend what's needed.
On the time limit, are you looking at an increase in work for next
The
year?
hours, there may be some increases in the hours in mosquito abatement. I don't know, Eric, if you remember on that.
It's separate. Oh wow, that works. They treated like 60, just thousands and thousands of collection areas, storm drain areas too. And just as an example, they also now have started to do testing for Zika and other surveillance that traditionally they haven't done. They've been doing that the past year, and they've ramped that up.
So if I can maybe pile on to Commissioner Lee's question, at least for me, the question I think what we're all getting at is if we're adding staff or if we're giving more money, what I'm missing from here is the additional documentation. We have an HR director that we, as you guys are familiar with, we like to review why we're increasing, right? Now, it could be a step because they've been with us 4 years, but there's still paperwork that goes with it that's missing, at least in my packet.
Again, if you look at their time-limited detail sheet.
That's not in my packet.
You can see that.
At least I haven't found it in my
17 of
68
their
pages.
time-limited employees are accounted for that they currently have.
They've been reviewed by HR. That's what I'm saying. I know they're accounted for. They do great work. I'm not questioning any of that. But to give even anybody a nickel an hour,
Yeah. Well, the
I
process is-
prefer it personally to go through HR process and evaluate why, so there's a documentation on how and why and what they're worth.
The process with HR is that if they work the 400 hours and come back the next year, they would get a 50-cent per hour raise.
Okay, so that's
established.
all you've done in here then?
That's all we've done.
Okay.
They haven't lost any. I don't think they're losing anybody next year either.
Okay.
Usually they have lots of attrition.
I mean, you know,
this
somebody
year-
may decide that's making $14, $15, or $18 an hour may decide not to come back.
So then, in
And
other
they'll be
words,
replaced with a $12
you would look at
an
this
hour
and
probably.
say, the only real reason for the increase is, one, we're returning staff, so 50 cents an hour. And because the budgeted amount is from a previous year, that would get you to your current levels of work with the same staff.
Yeah.
Okay. I can understand that then.
Okay, do you want me to go over staffing changes, or do you want to go,
Is that in those
Area
ones?
by
I don't see
area.
any for mosquito abatement.
there isn't any for mosquito abatement?
No, then let's go to administration.
Administration, huh? I don't think we had any,
You have 35,000 for website development.
35,000 for website development,
I understand pacing
as we hope,
furniture.
we hope. We thought we had everything the other week, set with those folks, and
Well, I know we've approved an agreement in commission meeting, because
yeah, and
I
it's
struck it
just,
down before Eastland came and let me have it. No.
sometimes things get so convoluted with attorneys, you know, talking from different sides. You just can't get things through. I thought we had everything resolved, though, and we're just waiting for them to sign it so we can bring it back to the commission. We'd like them to sign this one first, rather than keep bringing things to the commission and having to change it.
The only one for me in an admin that is tremendously out of line that I can't wrap my head around is special department supplies. You budgeted 300, but you want 4,700, and I don't see any detail.
On
4,800
special department
account.
supplies.
Special department supplies on your 4,800, on your 43,100 admin account. Like the others, I understand, like
Well,
the
I-
transportation, payroll,
So
mileage.
I'm gonna, since you're in that area right there, the budgeted amounts, again, go back kind of historically as what has been spent.
Sure.
And then if you jump right across, it looks like every number is to get back up to, probably a level that you had the previous year. I'm just wondering where those,
Again, you know, we try to budget for what we anticipate we might need. We may
So-
not spend it all.
Right, but, so the actuals we used on this year were 17, right, Janine?
Roughly, yeah.
And so, in your admin budget, like, you're budgeting literally the exact same as you had in 17. There's no increases, no contract increases. You feel like that number is good?
Yes, yeah, we think that, you know, we wish we could anticipate everything,
Sure, no, we understand that.
but
Not looking for
we
a
just
total
kind of go with, and,
anticipation.
you know, again. you
You're
know,
just trying to hold at your 2017, or 2018
We're not
levels.
gonna bump, we're
Or
not gonna bump
2017
things
levels.
up if we don't think we need to.
So your 2019 level, you're saying if it matches your 2017 actual in that account, you're good?
Well, I think our 2019 request is probably matching what we had budgeted in 2018, this current year.
Well, it's literally matching number for number across the board for your 2017 actuals. Just so you know, all your requests are to take them up to what you actually spent in
In
2017.
some cases, yeah. The one you were pointing out was, 300 was the actual for 2017. We requested additional 4,700.
What I mean is, normally any of the ones that you had larger balances, there was an explanation. There was no explanation in that one.
Yeah, okay. We probably
That's why it
could-
stuck
could have
out to
put
me.
that. And, you know, we can probably go back, but I'm sure it's probably just the fact that we're trying to, again, just because we have it doesn't mean we'll spend it.
Sure.
But we're anticipating that it could be different than 2017. You know, without looking, you know, 2016 may have been, we may have spent 4,000, I don't know, you know. And so far in 2018, maybe we've spent a few thousand, without having those figures handy. But our
Well-
feeling was that we needed the full amount.
so on that 4,800, or that, for that 300 and that 47, what historically is on there?
So in the 100 cost center, specifically for special department supplies budget line, 2016 was $28.62. 2017 was $115.21. In 2018, the budget was $7,000. Almost $3,000 has been transferred out, and $438.92.
Hey, can you group by 4,800s?
Altogether?
Yes.
Well, see, let me tag on that. So that's the reason why that, that line doesn't make sense.
Right, that's what I say. I want to find out, the next question is are they spending it in a different 4,800 and we've just marked it
We
wrong
just
on this?
marked it wrong and moved it back
In
and
the
forth.
4,800, or are we moving it somewhere else?
Because
So that may-
historically, we're $23 and
Right.
whatever, and
But, maybe they meant to put it in employee recognition or what, in that 4,800. So that was my question to you.
So 2016, all the lines in 4,800, 100 cost center, $3,528. 2017 is $4,700. I'm rounding.
Sure, that's good enough.
2018, so far spent or encumbered year to date is $39.25. 20.
And so we're
And-
probably on pace for another 5.
Their budget for 2019 is 4,800.
Without the additional.
Right.
See, so my guess is, Ralph, on those ones, you guys are turning back or doing something else.
From what
because-
Deneen is indicating, there's no reason that we can't cut some of that out.
Well, it sounds like you've got enough to still do what you're currently doing. And if not, you're probably off $100 or $200 and we
Most
can
of our
probably find
48
that.
Most of our 4,800 expenditures, that's just specialty department supplies, or, either employee recognition or some of the other. We kind of keep the preparedness funds under the administration purview, just make sure they're spent properly.
Sure.
And of course, some of those have some higher categories and spend more than 4,800 than we do out of a general account.
But I guess the question is with the $4,800 that's currently in there, would it be unreasonable if, even if you went up to like 52 or 5,300, that you couldn't identify another $400 or $500 in here anywhere to cover that? Or do you feel like you need it?
Probably.
But it's
Okay.
over now, what you've historically
Probably.
done.
Right.
Probably.
Oh, okay. The next one on my list, unless they have other questions, is environmental health.
I don't have, we're good to go to environmental health for me.
On the, let's see, wait a second, environmental health. My, all hazard planning, that's a different list. Nope, I'm good. Let's go to that. Let's go to environmental health.
And environmental health, we are requesting an additional environmental health scientist, one with the funding coming from two areas.
So again, hold on, just
Okay.
because you have these in order, just to state again, doing the quick math, line 1, the $76,760 is a request to put everything back at the 2017 actual levels. Okay.
Okay.
Then in order, you have a couple that I'd like to hear about, just
The new
because
ones?
they're big.
Okay.
The change monitors for 22 grand.
Well, that's not worded very well. What it is EPA becomes very concerned when we have large numbers of vehicles that fail and don't show up later being passed, which tends to mean that they may have been registered someplace else. And so what we're trying to do is cooperate with the other programs, have a centralized database that tracks when a vehicle fails, where it's registered. And if it's registered illegally, that then we go with DMV to revoke the registration until they get it registered properly. And our share of that, it's about $100,000 contract to have that central database.
And that's your portion.
Our share is about
Okay.
22,000.
So the increase due to uncover for diesel inspection program, that's the new law 1,
Right,
okay?
Yeah, that's just,
Part of that,
we'll just have to do
software
more
increase I get.
things.
I love this. Scheduled computer replacements for new X360s, Dean Richens quote.
Yeah, what that is we
Are you saying we
generally,
can beat it if we,
generally buy our computers out of administration and replace them regularly. We make environmental health budget some for theirs because theirs are more expensive than everybody else's. They take a computer with a,
But-
it's a laptop, basically.
but correct me if I'm wrong,
Yeah.
Denise, well, actually, it might be Denise. On the internal service fund, the replacement of the computers already broken into that?
The health department doesn't capitalize their computers because of the federal funding source, so they have
Thank
to
you.
purchase them.
That was really why that stuck out to me.
Right. And it's just really just because they have a docking station and a monitor. So it's a little more expensive because it's a laptop they're taking out in the field with them to do their work as well. And so since those are more expensive, we've made them budget for the difference. You know, we'll provide you with a desktop, but you know, if you need something else, you budget it to make sure you can pay for it.
Waterproof shoes. I would like to hear about your new position you would like.
Which one would you like?
On the same environmental health, you asked for a additional staff member.
Oh, for additional staff member, okay. Let me get to that. What that was is we received from the legislature an additional $38,000 to our DEQ services contract. The Board of Health also last year raised the wastewater fees with the hope of helping us get additional staff. And between those two, we feel like that will pay for an additional staff without requiring any general fund support. Now, and I made the note on there, and I tried to highlight it and hope it came through, that typically when we put in something like this, we don't put the funds into the revenues so that Deneen can add them later. But in this case, when we did the revenues so much before, in some cases, some of these got added in. That's one case.
I'm familiar with your practice. Again, I'm going to restate every time these come up. I don't have any HR documentation. In other words, our HR department is what it looks like to me, hasn't seen this request for additional staff, and there's no report on it. At least it's not in my packet.
Is
Yeah,
that something you're expecting that goes to HR before it
I
comes
do,
to a budget process?
Because that way, what it's telling me is, one, they have an idea, because the commission obviously has to approve the staffing plan, which is
Sure.
why we do this. But two, it tells me Ralph and his staff have gone through it to say, the other Ralph, has gone through it to say, not only is this valid based on their work, because he's already identified with you, but by the way, based on market, this makes sense, and here's the additional cost and benefits.
Okay,
That's the part we hold them responsible for.
all right.
Yeah, just to be fair to the departments, that's never happened before these budget meetings. It's always been typically all of the staffing plan changes get given to HR after the
Oh,
meetings.
because we've been seeing a bunch.
Yeah, they submit them and they're talked about here philosophically, and then they go to HR to do the analysis.
So those
that's-
one things that we've been seeing aren't from HR?
No, mm-mm.
So how come we don't have them here then? Those things here.
What-
That's what's not in my
The
packet.
staffing plan changes?
The same things we've been seeing.
The form, right?
Yes.
They're in there. It goes.
Is it just all the way at the end?
It's the additional budget request form, then it's the spreadsheet.
Oh,
and
there
then
they
it's
all
right
are.
after.
They're just
Yeah.
not, okay. I didn't print this one because yours is large, so I used my,
Okay, all right.
Yeah,
Okay.
those are
understandable.
all of those forms are all prepared by
Yeah.
the departments, and then we
This
submit
is
them
what
to
I was
HR.
referring to though.
Yeah,
I thought we were missing this step,
okay.
so I apologize.
No problem. And the next one for environmental health is an advancement for Lisa Schmidt, who is qualified, will have all the qualification necessary to go to an environmental health scientist too. Starting at the pay period one, and that's usually just, if the first step, if they're already above the first step, it's just one step increase in the raise, as it's been in the past. But we can have HR look at that as well and make sure it's accurate. I think they are. But we can make sure that that's the case.
Well, now that I see these in here, I'm comfortable that we'll at least get to that point, whether,
Similar thing for Samuel Patha, but he's a lower rate, and so when he moves to a scientist too, his raise would be a little
So-
bit more.
can I may be stepping out, and so the other commissioners can definitely weigh in on this. Since we live stream this YouTube-wise, it's probably more appropriate we don't use names when we're talking about staffing plan potential
I
increases.
actually agree with that, yeah. The next one is KT. Is that better?
Well,
I want to make sure you know which one I'm talking about.
There's numbers on them.
Oh, is there?
Yeah.
Okay. Mine don't have numbers on them, but, okay. Next
Well,
one is KT.
so like, for example, it'll say fund, department, job request code, right? Starting, it'll say the job request code, so we can use those.
Okay, all right.
So the department 43-120, which that's not this one.
Well, this next one is 3610, Environmental Health Scientist 1. Again, a technician who has completed the requirements to become an Environmental Health Scientist 1, which usually involves getting registered as an Environmental Health Scientist in the state of Utah. The same as the situation on the next one for a technician, 3610, Environmental Health Scientist. kind of covers environmental health. And, yeah, I don't know if you have any other questions about those.
Not for me.
Nope.
All right, nursing. Of course, a lot of the increases you see in that, from the base spreadsheet in nursing is just due to increased vaccine costs or increased number of vaccines, which will be covered, recovered with fees.
So
There is a request,
when you say with vaccine costs, are you talking in line one, the 482,000?
yeah,
Okay, so
200 of that is vaccine costs.
okay, but that's a weird statement to make, because in my opinion, in 2017, you literally spent an X amount of dollars. Okay, that's your budget amount. Your request is to return to the 2017 level. Right? Am I reading those numbers right on that one too?
Well, let me just look here real quick, see if I can find it.
Because when I go to the bottom here, it says that you're budgeted $3.6 million roughly. You're asking for an additional $482,367 to put you at a $4,166,000, which,
Well, the budget figure we were given to start with.
oh,
was
no, I read this
1.7
one backwards. Yes, I'm sorry.
1.7 million.
Yeah,
We're
yeah,
adding
yeah.
200,000.
So 200,000 of that's vaccines,
But
okay.
again, those costs will be covered by
I was
either
comparing it to
the
the
client as they
2018,
come in
sorry.
or the insurance company. And that was probably the big ticket item there. They do, you know, we've been able to recently, due to the addition of some epidemiologists from both county money and from grants, been able to add some strongly needed epidemiology services. But it's kind of cramped their office, and so we need to do some reconfiguration to give them some space rather than open space. And the estimate there is for about $5,400 to do that remodeling in the epidemiology area. A lot of the rest of it is for phones, for Payson.
What's an EpiCanon IR33? I assume it's a printer. So what's the $500?
Copier, I believe that's for a maintenance agreement.
I think it's maintenance. The 3050 would be maintenance.
So not through our IT, through somebody else?
Well, it's probably with Canon or whoever our service agreements are with.
Okay.
Yeah.
Making sure.
Now, you know, in all likelihood, we may have the phones for Payson before the end of the year, and we can cut that out. You know, it's just that, you know, when you're budgeting a few months before you get to it, you're kind of trying to cover yourself. But likely, we will probably have those phones before the end of the year and won't need them in the next year. The Herman Miller furniture there is just for the chairs we're going to need for that area for the public to sit in. Utopia Link, that's new. Just everybody that's in that Payson
Utopia.
building is getting a charge for Utopia.
Did they buy it back from Warren?
I don't know if anything else is in there is questioning or concerning to you.
No, that's pretty easy.
And as far as their new staffing plan changes, we included one that is really a duplicate of another one and should be cut out. There's one it's 11204, Public Health Nurse 2.
Parents as teachers?
Yeah, parents as teachers, but below on some of the detail, it doesn't have the account numbers in. But that was a draft form that got included that shouldn't be there. What this nurse position for the PAT is.
Wait, what? Mine have numbers filled in.
All the way? There's two of them.
Yeah,
Or at
both-
least we ended up with two.
Both of mine have, well, there's different account numbers. There's account numbers that, one has more account numbers than the other.
There's one that says it's a 1,200 hour and one that says it's
1,100 hour, yeah. I have-
1,100 is correct, the 1,200 should be discarded,
Okay,
okay? All right.
but the asks financially are the exact same.
Yes, yeah.
Okay.
Because the other one was a draft form as we were
Okay.
trying to prepare it. But this is for the intergenerational poverty grant that the county got, of which we were going to increase our home visitation program a little bit for. That
So-
has come through Commissioner Ivy in
Right.
spring. I
So
think.
the $61,000, is that
Yeah,
per
the grant
or
is actually,
total?
the grant is actually 74,000.
No. See, you've put 2 nurses.
Right.
Is 61,000 per nurse
That-
or
that's-
total?
That's for total, that's for
Okay.
two, that's for two. And, the balance of it will go into the rent and phone costs, and, other things that are associated with that overhead for that grant, because the grant's actually about 74,000. And what realistically we'll be doing is we'll be probably actually assigning some more experienced nurses to start that grant at least
Great.
and get it going. It's just 1 year, and so we didn't want to hire people that we couldn't let go if we needed to. And that's why there's no permanent employees there, just the 1,000-hour nurses. To either backfill for the nurses that are going to do this program for a year. The hope is that the grant will continue, but I haven't heard anything that's going to be the case, so. The next one is for 2022 Public Health Nurse 2. This is the Provo School District would like to have one of our 20-hour nurses there go to 30 hours a week. But of course, we've explained to the district in going to a .75 position,
Still
we would
benefiting.
expect the district to pay the full cost of the additional insurance. Because, that you're paying for full-time
I was
insurance.
gonna say,
for-
at that point, I don't know why they wouldn't just go to 40 hours because
I don't either.
cost
but-
isn't very much more.
But, it's, it is
Okay.
what it is. I agree with you, though. I say, well, if you're gonna go that far, go all the way. But it'll be explained to them that that's why you see the benefit costs being so high on that particular increase.
Sure.
The next two are 2002 Public Health Nurses 2. This is for the Alpine School District. They would like, they're exploding. Alpine School District's exploding. I can't say anything different than that. I think they've got 4 new schools coming on in the next year. They'd like to reduce, they have the worst nurse-to-student ratio of the 3 school districts. They'd like to reduce that a little bit
And the most money.
if we can come up with our end of the funding on that.
So 45,000 for each, roughly.
Yeah, that's for half year,
Right.
because it wouldn't start till July, so, pay period 14. The next 2 are for public health nurse coordinators. Now, this is what we've talked about with you in our budget meetings as we've gone through the year. And we did get the school districts in the contract funding that we currently have with them to pay for those school nurse coordinators starting in 2019. So for them, it was a half year, and then we'll pick up the other half with our new contract with them since they're on a different fiscal year. And so the contract funding has been included in the funding resources we already submitted. But since we're contracted for those, we're kind of obligated to do those. And that's what we discussed with you in our budget meetings so that you're aware of it then.
Right.
So this is more of a reminder than anything else. And that takes care of nursing, I think.
Health promotion. Why the additional time limited wages?
Well, the additional time limited for health promotion is due to the, there's what's called an opioid crisis grant.
Okay.
For about 80,000, just under 80,000 that's coming to us, where we have to come up with an opioid crisis response plan with the community partners. And so that's, again, it's a 1-year thing again, and so we don't want to get involved with full-time staff, though we may use full-time staff to do it, and then backfill what they should be doing with part-time merit staff. with some other areas. And so that's to provide for that particular program.
So it's a
That
potentially
actually-
only a one-time.
It actually started October 1st, but reality is we can't get started until January.
Okay.
You know, it's interesting how the federal government works, particularly when they think there's a crisis.
Whoa, they work?
Or they don't work, however you want to look at them.
I will say their fire crews and their communication do a great job.
So
What I have
that's-
seen.
That's the increase there. The other two for health education are just, again, career ladder type things from
Yeah.
for one individual in the abstinence program to go to a health educated one, and another position in
So-
chronic disease to go to
So going back
two.
to kind of my earlier comment, just so you know on those, now that we have an HR director that I know you've dealt with a lot,
And I have a lot
I
of
will,
confidence in it.
his opinion will weigh very heavily for me
And
on
we
these.
we can send all those to
Sure,
him,
sure,
so,
no, and I know they do.
yeah, so.
So
we
WIC
can do that.
doesn't have
WIC,
a,
WIC is kind of
Doesn't have
self-funded,
anything?
you know.
Yeah. so I say that we can skip
No.
over that. Unless you want to speak about it, there's nothing requested, so budget-wise,
Yeah,
We're
no,
we're good.
they actually help us by paying some of our overhead costs,
Mhm.
usually about 50,000 or so.
Okay.
It
Foster
really Kind
grandparents?
of helps us. Foster grandparents, senior companions, you know, their budgets are pretty much stable, other than the costs that increase for their staff. You know, there's no new money there, and I don't anticipate, the way they run things with the corporation, I don't know that that'll ever happen, so.
Make sure I don't go to this on senior companions. I never want to attend the AARP driving class.
If you can avoid it.
Yeah.
Now, we will, you know, we're going, as you know, Mary Ann is retiring
Yes, which is our loss.
soon, yeah, very big loss. We'll be interviewing for that position. If we're not satisfied with the candidates, we may come to the commissioners with a reorganization proposal for that group that would hopefully save some county money in trying to do things a little differently. But we thought we'd see who applied and what kind of applicants we really got. But if we're not getting what we think we need, we may come with a reorganization proposal to you that could save the county some money, or should save the county some money.
Healthy lifestyles, I'm offended to see $100 extra in mileage. They should be walking everywhere.
That's right, they should be walking everywhere. That's a good point, actually, isn't it? Or biking or something.
Yeah.
Yeah. You know, but, you know, very conservative there. I mean, we're still, you know, Carrie was out a lot of this last year, as you know. And so we had other health educators kind of covering for her as she had her baby and things.
I saw her over the
Unfortunately,
convention
those
center at your
costs don't always
conference.
get shifted over into the healthy lifestyle. But it goes for a good cause. So we're happy with that.
Oh, okay.
But again, you know, we support the commission. We're here to help. You know, we do serve the entire community, not just the unincorporated areas, and so growth really kind of pushes us a little. But like I say, hopefully with whatever happens in the budget, we'll still make the best do, and you'll still see us smiling, so.
Sounds good.
Well, I
Thanks, Ralph.
came in with you guys having to deal with the measles in Disneyland, and
Yeah, that's
I
right.
can tell you, watching you guys work for my 4 years has been an honor.
Good, thank
To
you.
watch you guys and your staff has been amazing.
We've got good staff.
You do.
And they respond to crises.
I still-
which happen, so.
Still very mad at the governor for taking Dr. Minor, because that's just one
So
more
is- so
asset
am
for
I,
us, but
actually.
thank you for your service and what you do.
Well, thank you. Thank you. Any other questions?
Nope, that's
All right.
perfect. Thank you, Ralph.
Did we keep you on
Very
schedule
well
or ahead
done.
of
Yes.
schedule?
Oh, yeah, you're
Well,
ahead of
we're way
schedule.
ahead.
You're
Thank
great.
you.
Very well done.
Maybe you can get home tonight.
Mr. Means, thank you for accommodating us.
My pleasure. What would you like to hear?
Gotcha.
That way, since we record them, they can hear it in the mics.
Why don't I just note that Joanna Landau is here with me.
You have the easy budget, other than the fact you just need to keep spending millions of dollars for all these fun cases.
I don't think you're gonna find this easy. I don't anticipate that, but
Yeah, we know.
could I start with a little housekeeping?
Sure.
Do others need these?
We will share them with Brian and Deneen.
I've got plenty.
Then, yes, they would like a copy.
Who got them? I am told that it was approved after the wage survey to implement the new wage schedule, and effective 1 July. That would be my request for my office, that top line.
Okay.
Lana, do you have one of these so you can follow? The second line is when the state, the IDC, funded in 2018, it was left to the county to pay for some workstations. There was a projection that they would be about 28,000 bucks. Well, they weren't. They were 11 by the time we got through. And then the last is, we believe we've probably expended all the CLE monies we're going to expend this year. And the contract or the grant with the state provides for reimbursement of up to $14,000 for both 2018 and 2019. We have been conducting most of our CLE sessions in-house in our office. We find them to be more productive, frankly, but we've attended, there's a statewide seminar every year for all attorneys. There's a second statewide seminar for capital cases, and there's a statewide seminar for juvenile attorneys, practitioners. So that's where we've spent that money. The last two lines, capital contract.
Yeah.
We've had a real hard time communicating with whoever we need to communicate with to get the capital expenditure on the bomb case. That's the Eureka case. That's the best way to explain that. I understand it's been approved and it's coming, but that number that you see to the far right on the second to the last row is what we're in arrears to our providers that we're trying to catch up with.
So, that is this the first one or the second one where the judge told us you have like 3 days to get one?
This isn't that one.
Okay, okay. I was gonna say,
That
'cause
was the one that
this was the first one a month before that, then, roughly.
actually clear back in about January.
Okay.
We've had we currently have two open capital cases in our office right now. One is Polson, and this one is Baum. This one's been open since about January, and I think the Polson case has been open since
So
about,
what's in arrears on, we haven't paid the contract attorney on that?
it is our office, it's not the contract attorney.
Okay,
It's our office because capital cases are excluded
okay.
in general operating contract. I'll give you a preview too. I believe that this case is going to be taken very seriously by the county attorney. I would doubt very seriously if it is settled unless something factually occurs. I think the attitude of all persons involved is going to push this as far as it can go. So I'm letting you know that up front.
Including appeals, you mean?
Oh, yeah. Appeals are mandatory.
Right.
So
So can I ask you from a timeline standpoint, obviously I won't be here for the future, but funding, and it's hard because we know we have an obligation financially, right? But there could be an appeal, and the appeal might not happen, and costs might not be incurred until 2021.
Possibly.
So I guess that's kind of what I've been waiting for. What I've been asking the attorneys upstairs, and I realize I shouldn't have been asking them, our civil division, because even though they brought us the contract, I guess the question is what do we need? Where do you feel we need to be every year to help you feel comfortable? Because we can always go and open the budget and get you what you needed within a 3-week period, right?
And we're talking about the capital.
Just these capital cases, yes, because those are the expensive outliers.
They are. Are you talking about the protocols of how we do it?
No, I just want to know financially how you see this. So going forward, I can see the arrears part. That's easy to deal with. But the 2019, how do we set aside an amount for a budget? Because is this case going to be fully heard in there as far as witnesses and expert testimony, those type of things? Because
that is my prediction.
Okay.
I believe this is a case that won't settle. It's probably the first trial we're going to have, capital trial we're going to have since the Laffertys.
Okay.
They don't come often. They can't really be planned for.
Right.
And the expense per case really can't be planned
Sure.
for. They just have to be done.
The second one that we just received, any chance that hits in this next budget year at all?
Yes, it will bleed over into the next budget year. The one that we had to conflict out of the
Yes.
office? Yes.
Okay.
I would predict that would last well into next year.
So roughly guessing,
Excuse me? No,
no.
no.
I'm talking about trying to, and unfortunately, to make Commissioner Lee use his favorite thing, crystal ball, because unfortunately that's what this one is.
You know, that brings up an issue
It's not really a crystal ball, because we know what's before us.
it's coming.
Right.
So it's,
But I mean, to set a number as a placeholder in the budget is all I'm talking about.
This is a very factually intense case that we're really investigating.
Which means a lot of expert witnesses.
Well,
Typically.
eventually, yeah, we haven't retained any expert witnesses yet. We've retained investigators. But the experts will come.
Right.
It
And they're
brings-
generally 20 grand a pop at least, by the time
Well,
you get
it's
them
hard.
here.
It's
and-
hard to say, but they're not cheap. This kind of brings up a point that I think we all should be recognizing for the future. It'll be long past my time. But I think that Jeff's office and my office are the leading indicators for the county. We've always grown. I've kept record of our growth and the county's population growth. We've always grown at twice the rate of the county, our caseloads, both of us, not just me, but both of us. If you had asked me 5 years ago, I would say we would average a homicide about every 18 months. I think we have about 6 open homicide cases right now. 2 of them are capital. The others weren't charged as capital, but we have about, and I could be low, I think about it.
Well, he has
half dozen.
17 on his board, or he
Pardon?
claims. He has 17 on his board, or he claims.
Okay, well then, I'm sure we have the majority of them. We're just growing. We know we're gonna grow in numbers.
So what that tells me, and again, I'm only trying to use a predictor for the future. So roughly, you guys end up with about half of those, it sounds like. Close.
I'm probably wrong. I'll bet we end up with more than half.
Okay.
It would be expensive to hire private counsel to represent you in one of those cases. I should go back and be more precise. I was just
Oh.
shooting from my hip, but I would say most of it, the majority of it. But we're gonna be Salt Lake County in more than just numbers. We're gonna be Salt Lake County in culture, probably, I should say.
I'll say that.
That's my prediction. So, anyway, that's,
Not until 2060.
yeah, but we're gonna get there sequentially. That's the capital contract. The other is extraordinary cases. You're all aware, of course, of the reserve we carry for our conflict counsel when the are assigned a case that's out of the ordinary, that takes more of their
So-
time, or,
The only question I have on that is, you're right, we all understand it. Deneen has given us a list where she hasn't seen the full backup for 2016 to substantiate all of the charges. Same with 2017. That she hasn't seen any reconciliation and hasn't seen any for 2018. So it's hard to bring that to balance without those numbers, please.
that, easy to do. I keep a running,
I know
Oh,
you
through the
do,
years,
but
so-
Deneen needs them, so we can refill your bucket, as it were.
okay, we can do
Can
it,
I back up and ask you a question on the 5 workstations?
sure.
And looking at the applications, when you came to my office and we sat down to apply for that second application, there was a $25,000 allocation in there that would come from that grant. And I don't know, was that towards rent? Or was that towards?
Are you talking about the modification that we
I'm
just
talking
spoke
about
about?
the original contract. The original contract had a $25,000, I don't know, I couldn't tell if it was a rent. I didn't look close enough because I was thinking of the
I
second.
think it is.
So
I don't-
it's rent, it's not
Yeah,
workstation.
I don't have it in front of me, but Joanna can answer this question precisely, but it's my understanding that the grant, you're allowed to pay for personnel and costs, but not,
Yes, not equipment. I remember, it was not, we couldn't buy equipment, that I remember. Right,
Yeah.
but we funded all the people and the, yes.
And then,
costs
and then
associated.
in the second one, we did the same thing when it came to the offices again.
Right.
and I think the rent in that case was 10 and a half or
Yeah,
so.
we had Richard
Yeah.
figure that out for us.
Yeah, you had that already for me, but, and we're anticipating probably half amount of workstation costs for this adjustment for 2019, which I'll present later.
What's Mountain West Telecom, just out of curiosity? You're not on the county system at all?
Let's see.
It's just part of your workstations.
Yeah, I believe it's telephones.
So you're not on the county system, that was
No.
really my question.
No.
Okay.
Amicus is an operating system.
Yeah, I was okay with that. I just thought for some reason we'd have you network, or on the county system.
My office manager could help me, but I believe that's the telephones. PC networking is
Right.
computers. Works, that part of the workstation. So, I am making that official request for that bold number,
Okay,
And-
so,
making you aware of pending requests later.
if I follow this right, 78,146.69 is the request,
Yes.
plus reimbursement of 39,531.72.
No. Yes to the first question.
Okay.
No to the second question, because I believe that has already been approved. I'm just letting you know that we're in arrears to our providers, and we're waiting for
Well-
that contract to be paid out.
We probably need to talk, because I don't think we approved it the way that you're thinking today. I think we did it by identifying funds within.
The contract was signed for $50,000 and $25,000 was due immediately, and the other $25,000 was due around November. And the first $25,000 was sent direct deposit today.
Just today?
Yeah.
Okay, so the other portion, okay, so that one's taken care of.
And then the other one, there'd be budget transfers to get the money in there, but there's enough time to do that, 'cause
Right.
the payment's not due till
I
November.
And then the 20,388.70, when you give Deneen numbers for 2016, 17, and help her reconcile 18, that helps us get back to that 75,000 reserves, right?
No,
Hypothetically,
that one should have another contract, because as far as I know, there's only been 2 contracts for $50,000 each.
okay,
There was one at the beginning of the year, which has been fully paid for the 50,000, and then there was the one that was recently signed.
so we need reconciliations and a new contract agreement, so
Right.
we will get that on the commission agenda because
I
contracts.
correct that one.
Please.
One issue. I believe, I don't have my operating contract in front of me to read, but I believe that's included in the contract, and I'll show you.
Yeah, my understanding is the attorney's office, it says that it has to be done separately, so there were separate contracts for the
Okay.
extraordinary expenses.
If it's there, great, if not, let's get you one,
I'll work it out with whoever I need to work it out with.
yeah. Since I'm I think I'm still yeah, I'm still your portfolio. I will get it on the agenda if we need to.
I'm not actually asking for that right now. I'm just
Right.
giving you a preview
I just mean for the contract.
that's coming.
If we need to, though, we need to get it done.
Yes. Okay?
Want to move on then?
Yeah.
Here comes the fun part.
Oh, the capital cases were already the fun part.
Thank you.
If there are, I might want it back.
Yep.
The bolded number in the top table is what I'm asking for this year, and I know that's, as I told Joanna today by email, exponentially more than I've ever requested. I'm not naive to that, and I'm more than happy to sit with Janine or whoever and go over I use Excel, and I've worked that and worked that and worked that, and that is the number.
So, 2 years ago, when we met upstairs, you talked to us about a potential third or new management structure.
Hmm.
How does this differ in that in any way? Because I think
we-
you said we were headed there because of
Yeah.
caseload and time. Is that just,
We've just never implemented it. but,
okay, this is that same structure we talked about?
It's a step in that direction.
Okay.
That second table will show you that probably what occasions that big number is the fact that there are now 8 new attorneys, 3 new paralegals in the system, which is a 40% and 75% increase respectively for the office.
Was that a request, or that's what you've already
That's what we
hired?
have. That's what's in place. We now have 28 attorneys, 7 paralegals, 3 legal assistants, an office manager, 1,000-hour employee, and then we contract with 19 attorneys outside for conflict of interest. We actually contract with more than that. Those are the ones who are
So,
constant. We have 10 in the district court. We have 6, or actually 8 in the juvenile court. And then occasionally we will contract with a conflict of interest appellate attorney.
so I guess, Tom, my question is then, for the $1 million, roughly $1
Mhm.
million, what's being added or what's new from your current, because I can see where you're accounting for the money,
Mhm.
but 8 new attorneys, 3 new paralegals, it sounds like you've already hired them.
Yes. Well, 3 of the new attorneys will be put in place on 1 January. So this is only as 2019.
So I assume you're paying for those out of the grant money then that you've identified.
Correct.
Okay, so 3 of the attorneys are out of that grant money. So with the other $1 million, we get 3 new paralegals, the new management structure, everything. So with $1 million, your whole office now will look like that 2019 box.
Exactly.
Okay.
Exactly. And the bottom table lets you know by major categories of the operating budget, where the increases are, the percentages and the dollar amounts. You can see, and it's this way every year that I come to you, it's all in people.
Right.
Contract attorneys will actually go down a bit from last year simply because we had a lot of law clerks in place, and they won't be in place this next year. We'll have some, but not as many.
So can I ask you the other question? Because I know I would ask it of Jeff Buman, which is the
Sure.
only kind of comparison.
Okay.
If the commission funds this fully,
Mhm.
how does that benefit us? Aside from the obvious, we have more people, split up caseloads, and how long does that give us as a county? Is this something we can expect to grow exponentially like this every year? How do you see this going forward? And I understand that's a loaded question because
Hard to say.
yes, but your best guess, because you're a very smart guy who has served us well.
Well, I've been watching it, I'll say
Right.
that, so I've been involved. I told you earlier that our growth rate is about twice what yours is. that's not gonna last forever, but it's gonna continue. If our growth is going to continue like they're projecting it, we're going to grow at the same rate we have been until the population bell curves out at the top, and then we will too. So it's going to be constant growth. I don't believe that it's going to be 8 new attorneys every year. I think this has been something that is compensating for needs we've had in the past coming forward. And I believe this is maybe puts us at a place where we can now add, and I think we should start thinking this way. There needs to be a quotient, I believe, going forward, rather than either just having me come in and ask and you consider it.
So you mean
Yeah.
caseload equals
Yes.
certain attorneys?
Yes, yes. Something that we all can watch, project, and understand, and be prepared for as time goes by.
So
And
my
I'm-
natural inclination is on something like that is, I look at it, and again, I know your staff's been tirelessly working, overworking. But the problem is I also look at it and think, wow, look what we've got. They've been able to manage. Might be a little on the steep side because of this request, but it would be my fear is that we take that calculation and set up a quota, if you will, based on the new numbers, based on what we've already done. And I know there's probably a somewhere in between, and that's my whole problem is I don't know how we ever get there, right? Because school nurses, they tell you 500 students per school nurse. Well, that doesn't even come close to working, and we do a great job. We have 7,500 per one. So how do we get there?
There are published recommendations for caseloads. I recognize that a caseload in California is not the same as a caseload in New York, as a caseload in Texas, as a caseload in Utah. But somewhere in there is a quotient that makes sense. It may have to be adjusted as time goes by, but we haven't done it in the past. But I would suggest that when we all have time, that we sit down and try to.
So
do
being
that.
one of only 2 states, Michigan being the other one that, because all those states you mentioned, their state stepped up. Our legislature's fantastic. Counties we're gonna inhabit, we're gonna keep sticking you with these bills and adding courts. Anyway, personal grudge aside, how does Michigan do it too, would be part of the conversation I'd like to have with you in the future. Because,
I'll have to look, because I
no,
don't
I
know.
understand, because, unfortunately, that's more the model that, I'm curious to see.
Well, they
compared
probably
to-
don't, and so, you're touching upon an area that, this is my concern as I look at these numbers too. This is the state's responsibility.
That's
We
right.
know that. They're not stepping up to the plate. They're trying to put little stabs in here and there. $1.3 million, they're putting in currently into this process, which is a Band-Aid. And my fear is that when it goes away next year, then what? Because now we're looking at another 1.3, and so we've
That's
got one here, now we're looking at 2.3, and it just, and then they say, oh, well, you guys are just gonna have to suffer the consequences. Well, the state's gonna suffer the consequences if they don't fund us appropriately when it comes to these levels.
Well, we could
that
do
we're
what their
seeing.
answer is when they don't like it. Put on the ballot a 10% gas tax increase. Just kidding.
I just don't know how far we go with this, because I thought the 1.3 with us, with the grant funding as we were talking with them, was gonna get us down the road to a certain pace. I figured it'd at least get us through the 2-year process that we're doing this grant.
It does on the new people, and I looked and I watched and I tried to figure out why the number is what it is. I attribute that 1030963 totally to our existing employees with an increase in the step rate, I use that term, and their natural progressions. I'm happy, as I said, I work with Excel. I'm happy to sit with Deneen or whomever and go through my numbers and make sure I'm right, but I will tell you that I've gone through them so much that
So-
when I saw that amount, and
That doesn't make sense to me. When you say,
it doesn't make sense to me either,
Huh?
frankly.
You got 61.
yeah, you wrote
So that should be
61,000 to give,
120.
to put back at the staff increases.
And I double checked that too.
Well, that number I agree with, like, because again, we're talking based on this number of employees, I can roughly do it in my head, based on how the county's done it. But now, what you've just said is $1 million is really to put everybody at the right pay level. That then what's the 61,000?
For half a year.
Pardon me?
For half a year.
Half a year,
So if we
yes.
double it
and
for
Yeah,
a year,
that's
it's
no
121.
No increases, just at that
Well,
rate.
61,000 gives you the increase.
Well, I should say this way. There are increases to match the new step table, but no increases in rising on the
Oh,
steps. You see what I mean?
Like the 2.3.
Performance evaluation
Yeah,
type.
Performance evaluation?
Yes. That's what-
Okay. So, 1 million is putting everybody more into market and
Good word.
adding additional attorneys to help with the workload. That's how you're couching that now.
Yes.
Okay.
And support personnel.
Right, new personnel
Right.
plus marketable wages to match.
Yes.
Okay.
I
would-
think that's
Since
stated
I am an
correctly.
Excel junkie, I would like to actually sit and
I'd-
see that
I'd-
breakdown, just so I can see the difference, right?
On over, I'd be happy to sit
Okay.
with you, and I think
Lisa
we
will call and
should.
get with you.
I
Yeah,
think we should.
yeah.
The grant funding stays pretty consistent, right? It doesn't jump up. We're not paying over and above for employees on salaries more than what the grant
You mean
is
the new
allowing.
employees?
The new employees.
No.
Yeah,
No.
it stays
Yes.
consistent, yeah.
Maybe I should have Joanna address some of your questions when you start talking about the state, but that's my understanding.
Oh, I'm not gonna talk about the state. I got nothing nice to say. Just kidding. I'm just kidding.
You want to speak, Joanna? Sure.
Are you bringing money?
Well, let's talk about that. So I'm Joanna Landau. I've had the pleasure of talking to the two of you about the Indigent Defense Commission, but I'm the director of the Indigent Defense Commission, which the states started in 2016 to make up for those 50 years where you guys were solely charged with this Sixth Amendment constitutional responsibility. And to your point, crystal balls are hard, right? I'm in the crystal ball business. How does the state make up for these 50 years? How do we figure this out? And right now we're figuring it out a bit on an ad hoc basis. That 1.3 million that you have is just 1 year of the grant. We actually gave you closer to 1.9 over 2 years. So looking forward to fiscal year 19, we actually obligated some of our fiscal year 18 money forward to Utah County. We have prioritized this county enormously because you guys have been, first of all, this county prioritized indigent defense. You're the only county in the state that created a public defender office and has sustained it over the years. And that enormous commitment is important to us, and so we wanted to prioritize the county. You've also been really key to us in helping regionalize indigent defense. You're helping out in Juab and San Pete counties, and so we're actually funneling even more than the 1.9 through your office via those grants.
We just don't see that in our budgets because it's.
Exactly.
Right, yes.
So we, the IDC, are going to the governor's office. We just submitted our budget request, and it's pretty significant. We don't know what we'll get out of it. So far to date, we've obligated about 4.6 million to about 22% of counties. We have in the queue almost 40% of counties. So we're asking, one, for new grant money for new counties, but also for grant money to re-up the existing grants that we have, because we don't want that risk exposure for you guys to have created this system and then for us to go away. So one, I'm gonna need you up in the legislature helping me advocate for that, because it's your money really. And two, to get that money and to get the IDC to continue it, yes, we believe and we support in this county, but Tom's office, Tom is an asset. I don't know that you know what a
Oh, we do.
gem
Oh,
he
we do.
is,
Yeah.
relatively
Oh, we do.
speaking.
There's a reason he gets published and we praise him all the time.
Well, and he keeps better numbers than anyone in
Right.
the state. I mean, we trust him to keep our numbers, you trust him, and he's been bulletproof. He's also very incentivized not to go to prison, right? He's got,
He says that over and over.
well,
Actually, based on our new health insurance policies, I'm not so sure. It's
well,
3 squares and the best mental or health insurance you can have.
so the takeaway is there's a push and pull. We want to prioritize you, but we can't supplant your funding, and your obligation still is statutorily to provide for this. We are there to improve things, but we need to see a commensurate funding to keep funding Utah County at this level. It will put you in much better stead to meet these this amount, this increase in funding to be able to then come to us again for the continued funding through the grant money. And with other counties where we funded things, we haven't known exactly how to fund it, back to that crystal ball. This crystal ball is pretty certain, right? You've got employees, you've got benefit numbers, you've got pretty certain numbers. So your number is pretty certain, that 1.3.
Here's my question that
Yeah.
I'd like you to kind of address. Again, all the kudos to Tom and his staff, right? I'm not even appalled by the $6.5 million-ish number. I'm not. We have been getting a bargain. Now, I'm offended who has to pay it, but the number for what it does, tremendous, right? I expect it over the next couple of years to go to 8, 8.5. I know that's coming. My problem is, how come the state, and what commitments do we have from you guys to help us get there? Because it shouldn't just be the burden of the taxpayers here, because when it got public about one medical condition in the jail, the outrage in this county was crazy, crazy, crazy. And so when they find out these are the kind of monies we have to pay because the legislature's passing the buck, which, so for me personally, this is why I contend that property tax increases have to be discussed, because the legislature passes the buck to us. Now, it doesn't mean certain numbers, I'm not getting into that. But what assurances do we have, and how can we continue to get some of these helps? Because again, unfortunately, Tom, like all of us, have an expiration date. But these cases don't.
With population,
Yes.
crime will likely continue. You're exactly right. So let me go back. So your current funding, the 6 million, you're still only funding Tom's office, even with the grant, at about around $8 per capita. Your county attorney funding's about $14 per capita. So
So we should match theirs.
no,
No,
it's
no,
not
no.
a direct.
We should match theirs to Tom's.
It's parity it's not an exact parity equation. Defense attorneys actually arguably have to investigate more, but prosecutors do a lot more screening up front. So it's not a complete comparison, but it is an indicator of where funding should be. Our funding, state funding, comes out of sales tax, right? We're funded
Right.
out of the general fund. And my job description is to go lobby for that funding and to go ask for it. And getting these numbers helps us say, this is the concrete need. And state, if you've created this need and you've identified it and you don't fund it, it's pretty big risk exposure
Yeah.
generally.
Yeah,
So,
If we can find somebody to hold them accountable.
yeah. So. oh, go
so
ahead.
assurances,
I'm
I
not
can
sure.
promise nothing, right?
No,
But
no,
it
no.
is my
I know you can't
job
literally say
description
that,
to
but
fund that, or to get that money.
okay.
I see you on our side, just so you know.
No, I do too.
And I,
Right.
but there's a couple of things that and you can help me get past some of them, hopefully. The state has $800 million in there. I mean, it's just
Big
sitting
budget
out there,
year.
right? They
Yep.
have $800 million. And that always bothers me when I see those kind of numbers out there, because and here we are scrapping to try to find whatever we can to make things work on an area in which rightfully they're responsible for, but we're trying to pick it up. Second, this and then just in public funding itself, that always, and I don't know if it's correct or not, but I've seen it happen before, and that is that when we have grant monies come in, they're for short periods of time, and sometimes they get stripped away. That's always a fear. But behind it, and this is the little secret part that has happened, I'm not saying it is here, but that as soon as the grant funding, so if we can get to a certain level and then also ask for more, if the grant goes away, then we're at a certain level that we've already accomplished. And it's kind of the backdoor approach to getting funding indirectly. And it bothers me, because I don't know, hopefully that's not the case with this, but I think we do need to have that kind of conversation on where we're going and where that funding is going to go into the future.
You have a very powerful senator and very powerful representatives on budget committees, right? And that argument is what I can make to them when I'm up there, but they also need to hear it from you, right? Grant funding is not a solution to an ongoing responsibility.
Right.
What is the solution? If we got 100 million tomorrow to take it over, I doubt we could get that up and, I mean, I don't know what that would look like. Other states have done that, right? Just
Right.
taken over the entire responsibility. I think what we're building is the numbers and the basis for the state to be a true partner in this game. And so,
My concern is what the state would do is like they've done in a couple things, right? You've acknowledged, because we know it all to be true, that Tom probably is the example. In fact, the governor acknowledged our health department being an example when he stole our old director. because he worked here, right? Like, there are a lot of people in Utah County that are the example because of some of the stuff we do, which has allowed us a lot of things. The problem is then they give us JRI and they change our funding level, even though we're an example. That's the fear, right? That's the fear I have. It's, you know, again, Tom's doing it well, but all of a sudden you start interjecting the state and it's like, well, I think it should be done this way because Senator Weiler's person says it should be this, whatever. And I just picked his name, not just.
He's on our commission,
No,
so that's a good
right.
name to pick.
So.
I mean, I hear these concerns from Paiute to Salt Lake County,
Right,
right?
but the reality is, no offense to Paiute, they don't have a $6.5 million proposal because they don't have these kind of cases. They're financially where we were 20 years ago.
Oh, and Salt Lake County has a $20 million
Right.
commitment in this.
Yeah.
So, yeah, I mean, I hear you and I understand it, and I know that is there are two single biggest concerns. Will it go away? And what's our exposure to this? I mean, and I think those are questions that we're
Let's see if it
working
goes
out.
away. See, and that's again, so let's say all three commissioners support, and again, we don't decide this today, but
Right.
we support Tom and we give him $1 million to add to staff, okay? And the grant goes away next year. It's not a $1 million ask. It's now a $2.5 million ask next year, plus staff increases for normal increases. That's a lot,
I agree.
right?
Yep.
Because it's a lot harder to go to Tom and say in the middle of capital cases, appeals and stuff like that, dude, cut $1.5 million, sorry.
You can go to your county attorney and ask him to stop prosecuting. That's the other side of things, but.
Oh, I've tried
it's a tough-
that, trust me.
It's a tough conversation either way, and I understand
I
that.
tried to get him to release a prisoner that he fought me on, so.
And I hear it, and I'm committed to this. I mean, Commissioner Lee, you're right. I am on your team, and I'm up there trying to ask
I
for your
believe it.
money.
Yeah, and my
So we
complaints
want
aren't
to
to
be
you.
with you, and so make sure and keep us in the loop with us, because we get going 1,000 different
Yep.
miles, you know, in different directions. So
I will touch base in
make
January.
sure and we might need to do that before January, because,
You tell me and
I
I'll be
mean,
back.
when we're talking about budgeting and interim and everything like that, a lot of those things are set before we even get there, especially on budgets.
Well, the position we're in
Appropriation.
is that we are a governor's office agency, so we ask the governor's office for a certain amount, and what the governor decides is what we're committed to. So once that happens, then we are bound by that regulation.
I know you're stuck, and you're stuck in a
But
bad spot.
Senator
but-
Weiler's not, and the commissioners
Right.
on my commission aren't, and you aren't,
And we're not.
obviously. Right.
Yeah, so allow us or help us to be able to go around where you can't, because I know you can't.
Well, we were thinking of doing for all of you commissioners in 29 counties is giving you talking points, right? Giving you just a laminated sheet. So when you call Senator Bramble and you make this case, these are the points you're making. And
Yes.
because I think we need a quorum, right? I am not powerful enough to advocate for 29 counties and the 35 odd million.
Well, so does it help us to go meet with Mr. Harding or Mike Mauer or the governor to make sure we get the appropriations for Utah County?
Would never discourage you from advocating for this to anyone.
Okay.
So that's where we are, and I just want to emphasize that we are committed to this county and committed to helping you keep meeting this responsibility with Tom's amazing
Right.
office that's been triaging for years.
Well, and thank
right?
you for your help and what you do too.
And you all know how to reach me if you have any other questions.
Okay.
Thank you.
Thanks. I dare not ask Tom, my next words out of my mouth, we're gonna say anything else?
I'm done.
Sweet.
I believe I'm done.
So the only thing that's not in here though, and I was trying to get at this, is setting aside money for capital expense cases. That's not contained in here for expenses.
No, it's not. It's not in these
That-
numbers.
That's, and again, I know there's no exact, but we do kind of need a budget holder,
We'll just hold the same with what we've always done last year. I think we put, what,
$75,000.
$75,000.
But he's gonna blow through that in a
Well-
capital case.
To be precise, we're confusing two things. The 75,000
It's extraordinary.
is for, yeah,
Oh, that's
and
right,
that
yeah.
helps
right.
fund our conflict of interest attorneys when they have an exceptional, extraordinary case. Witnesses, experts, investigation, or just time, or a combination. The capital contracts and I'll sit with Deneen and I'll sit with one of the attorneys, maybe Paul or somebody, and I believe we can both recognize that we do have a provision in our contract for the reserve fund. And we have consistently and historically used outside contracts for the capital cases.
Right.
But and that's my question, is we need to make sure there's enough in that reserve fund. So we need, and again, poor term, crystal ball, your best guess on making sure, because I know we can open the budget, but we kind of need to prepare and have,
What reserve fund?
Well, he's just talking about the estimate of
Right.
what would be needed for the capital defense of that
a
case.
reserve fund for that case.
Well,
Because we're gonna have to pay it
Okay.
next
Right.
year.
That's right.
This year we had
I thought you were talking
50,000.
about a fund that's been, I was trying to.
No,
Oh, yeah.
no.
no.
the best,
I was just using his term. Yeah.
the best indicator I can turn to is that top page where I'm letting you know we're now into Mr. Baum's case, $39,000.
But, yeah, but you're not in trial.
No, not at all.
And
We're just,
see, and-
just getting started.
Right, and that's my point, is because with expert witnesses and stuff like that, if I go ahead and hold $50,000, Tom, I'm gonna miss this thing by hundreds of thousands.
You're correct.
So I'm not trying to hold your feet to the fire. I'm not trying to hold you to a number that says, sorry, you've hit that number. I need a number in my mind, because I've got to have Deneen, Commissioner Ivy is the chair, and Deneen, and because she's budget officer, have to sign and attest that these numbers match our revenues and our best guess. We know this is coming up.
Here-
We
here's-
can't give that number. There's no way you can get that number.
It's, I
We
can guess.
can put a whole, right, and that's all it is.
I can tell you that I would project that I will probably be back to you during this next year twice
Sure.
in Mr. Baum's case.
Sure.
And we probably won't be at trial. We'll be closer to trial, but we will have been through preliminary hearings and some
Sure.
other motion hearings and so forth. But I would guess I will be back to you twice.
For another
in two or
100,000.
one.
Yeah.
Totally expect that.
I hope I'm close.
So I guess, Deneen, since we know it's coming, do we not need a budget line, and we could just always open it and take it out of reserves? Okay.
Or you can start off with an amount.
And that was kind of where I was trying to lean, so we had more of a snapshot. And again, it's all guess, because even this year, we'll turn back a couple million, or, So, anyway.
One last question. As to those adjustments I've asked for 2001-8, what do I need to follow up?
For what?
Steps
For
do I
what?
need to take?
For the stuff on this
On the
61,000?
Yes, 78.
I don't need anything on that. That's just a decision for, I think, the commission. I am gonna get with you on this proposed increase, because I would like to see the breakdown of new attorney costs versus bringing staff to market. Because to
And-
me, they're two different discussions and probably should be itemized.
Sure. You know where to find me.
I do, and I will get with you after this weeks of meetings are over.
Okay. If that's it, I'm done.
Thank you
Okay,
for
thank you.
coming early and all you do.
All right, thank you.